Don't get me wrong, they both have some efficacy if you are choosing the right candidate and setting appropriate expectations. I wouldn't say offhand that they both should be thrown off the table at all. I have been overall underwhelmed with Kybella, although there are some uses in very specific circumstances where I think you can get some change that is effective. Ultherapy has been around for a long time, and there are lots of threads all over the internet that are negative about Ultherapy. We have used it as a successful treatment in this office throughout the years because we're really selective who we're offering it to. And again, it's based on age, it's based on type of laxity. There's a big difference between volume laxity and thin skin laxity. And you want to show successes and failures to people when they ask about Ultherapy. You want to be really realistic about what it can and cannot achieve. One amazing thing about Ultherapy is that it is a zero downtime, more or less, procedure. So there can be some bruising. It is not comfortable to go through Ultherapy, and I think anyone who's had it can attest to that. It's a surgical procedure, and it is basically a surgery where we are accessing the neck through a really small incision hidden right in the crease under the chin, and doing what we need to in this area to get the sharpest and best result. So technically, if you dive into that, what that means is that it's contouring the fat under the skin and over the muscle. That's often done with liposuction. It can be done with conservative trimming of fat with direct visualization. The next layer is the muscle. That's the platysma muscle, this muscle here and here. And what I'll do is I'll access the midline portion of the platysma, and I'll raise it up to look underneath that layer. And it's a very different procedure than, say, just some neck liposuction or sort of a simple sewing of the platysma. We're accessing that deeper tissue and spending a lot of time contouring it. So if you safely debulk some of that deeper tissue, some of the fat, maybe some excess muscle out here, maybe a little bit of the front portions of the gland, and then take that platysma muscle that's been raised and suture it in a really particular way so that you're drawing tension in different directions to really define this cut, to create more hugging of the underside of the jawline. And you've appropriately contoured the fat above the platysma. All of a sudden you have this multi-layered contouring of the midline neck through a really tiny incision, and you can get these big results. And you can't achieve the kind of sharpness that I think a lot of people have in mind when they think about this type of surgery with liposuction alone. It can be short. If there's minimal bruising, sutures are out in 4 or 5 days, and though the tissue looks a little thick and a little stiff, people can be back functioning their life within a week. If they're bruising, it takes longer. Very honest time frame to talk about is when are you presentable and when do things look their best. In this case, you can definitely be presentable within 10 days. I think it'll look its best around that 2 to 3 month mark when all that tissue softens and settles. But the majority of people that we do this on are back to work, school, functioning in their daily life in that shorter time frame. So I had mentioned that you have a bunch of tools in your tool belt, and then you have to really study the person in front of you. What's the age? What type of laxity? Is it volume laxity? Is it thin skin laxity? If someone comes in and they have mild to moderate volume laxity, not a lot of thin skin laxity, and zero downtime, and they know they want just some tightening, some collagen stimulation, maybe that's an okay Ultherapy candidate. If someone says, I really don't want to undergo a surgery with incision placement, but I want more contouring along the lower jawline and the neck. We've incorporated RFAL technology, radio frequency technology. The company is called InMode. The treatments are called Face Tight and Neck Tight. And these are a big step forward in terms of a minimally invasive, not totally non-invasive, but minimally invasive treatment to contour this area, the neck area, and the jawline area, and the results are pretty impressive. I mean, the amount of hugging of this jawline, of contouring of the lower jawline and the neck for a treatment that has a 3 to 4 day downtime, we're really impressed with. And if you are a younger woman or man with really the concerns are in this area, there's not lower face laxity or mid-face laxity, then maybe a midline neck lift is the right procedure. And then, of course, the next step is L&P signature lift, which is a sort of modification of a traditional deep plane face and neck lift. And that's an amazing procedure if you want to affect change in the neck, the lower jawline, and this mid-face, which tends to drop, and you get the shadowing, collection of tissue here and shadowing here. It really comprehensively addresses the laxity that you see in this lower face and neck, and creates enough release and kind of rebound or resuspension in a natural way that you can get really robust results for that. And of course, you know, obviously you're treating the neck in all these treatments. So again, it's a matching game. And studying the person, studying their anatomy, expectations, what kind of downtime they can tolerate, the longevity of the result they want to achieve, and then having a really straightforward and honest discussion and trying to find the right procedure for them.